Wanna pass your NCLEX? Then let's get started. Today we'll be covering 10 questions on the management of care. This is a content area tested in the next generation NCLEX exam. Question 1. The nurse is caring for a client with a history of heart failure who is admitted with worsening dyspnea and edema. Which assessment findings should the nurse prioritize? Daily weight gain of 2 pounds, blood pressure reading of 140 over 90, crackles auscultated in bilateral lung bases, urine output of 30 ml per hour. Pause the video and select your answer. If you chose option C, you are correct. Crackles auscultated in bilateral lung bases. Crackles auscultated in bilateral lung bases suggest pulmonary congestion, a common manifestation of heart failure exacerbation. Prioritizing assessment of pulmonary status allows for prompt intervention to alleviate respiratory distress and prevent further complications. Question 2. The nurse is caring for a client post-operative following abdominal surgery. Which intervention should the nurse delegate to the nursing assistive personnel? Assessing the client's surgical incision for signs of infection, administering pain medication as prescribed, assisting the client with ambulation in the hallway, educating the client on post-operative dietary restrictions. Pause the video and select your answer. If you chose option C, you are correct, assisting the client with ambulation in the hallway. Assisting the client with ambulation in the hallway is within the scope of practice for nursing assistive personnel and promotes early mobilization, which is essential for preventing complications such as deep vein thrombosis and pneumonia post-operatively. Question 3. The nurse is caring for a client who is receiving continuous enteral tube feedings via a nasogastric tube. Which action is essential to prevent complications associated with enteral feeding? Elevating the head of the bed 30 to 45 degrees during and after feedings, administering medications through the enteral tube without crushing or diluting them, changing the enteral feeding bag and tubing every 24 hours, checking gastric residual volume before each feeding. Pause the video and select your answer. If you chose option A, you are correct. Elevating the head of the bed 30 to 45 degrees during and after feedings. Elevating the head of the bed to 30 to 45 degrees during and after feedings help prevent aspiration by promoting proper gastric emptying and reducing the risk of reflux. This position also helps prevent complications such as aspiration pneumonia. Question 4. The nurse is caring for a client with a new diagnosis of diabetes mellitus who is receiving insulin therapy. Which intervention is essential to prevent complications associated with insulin therapy? Encouraging the client to eat regular meals and snacks, monitoring blood glucose levels before meals and at bedtime, administering rapid acting insulin before meals, teaching the client about the symptoms of hypoglycemia. Pause the video and select your answer. If you chose option B, you are correct. Monitoring blood glucose levels before meals and at bedtime. Monitoring blood glucose levels before meals and at bedtime allows for the adjustment of insulin doses to maintain glycemic control and prevent complications such as hypoglycemia and hyperglycemia. Regular monitoring is essential for optimizing insulin therapy. Question 5. The nurse is caring for a client with a history of stroke who has difficulty swallowing or dysphagia. Which intervention is essential to prevent aspiration? Administering thin liquids through a straw, placing the client in a high phallus position during meals, encouraging the client to take small, frequent bites of food, assessing for signs of aspiration pneumonia. Pause the video and select your answer. If you chose option D, you are correct. Assessing for signs of aspiration pneumonia. Assessing for signs of aspiration pneumonia is essential for early detection and intervention to prevent complications associated with dysphagia. Prompt recognition and treatment of aspiration pneumonia can help to prevent further respiratory compromise. Question 6. The nurse is caring for a client with a central venous catheter. Which action is essential to prevent complications associated with CVC placement? Changing the dressing over the insertion site daily, flushing the catheter with normal saline every 12 hours, monitoring for signs of catheter related bloodstream infections, securing the catheter to the skin with tape. Pause the video and select your answer. If you chose option C, you are correct. Monitoring for signs of catheter related bloodstream infections. Monitoring for signs of catheter related bloodstream infections is essential to prevent complications associated with central venous catheter placement. Prompt recognition and treatment of infections can help prevent serious complications such as sepsis. Question 7. The nurse is caring for a client with a history of chronic obstructive pulmonary disease who is receiving oxygen therapy. Which intervention is essential to prevent complications associated with oxygen therapy? Administering oxygen via a non rebreather mask at 15 liters per minute, monitoring arterial blood gases every 4 hours, providing humidified oxygen to prevent drying of mucous membranes, educating the client to use oxygen continuously at home. Pause the video and select your answer. If you chose option B, you are correct. Monitoring arterial blood gases every 4 hours. Monitoring arterial blood gases every 4 hours is essential to prevent complications associated with oxygen therapy, such as oxygen induced hypercapnia or hypoxemia. Regular monitoring allows for adjustments in oxygen therapy to maintain optimal oxygenation and ventilation. Question 8. The nurse is caring for a client with a developmental disability who is admitted to the hospital for a surgical procedure. Which action by the nurse best demonstrates advocacy for the client's rights and needs? Obtaining informed consent from the client's legal guardian, allowing the client to make decisions independently without guidance, providing information to the client using complex medical terminology, collaborating with the interdisciplinary team to develop a plan of care based on the client's preferences and abilities. Pause the video and select your answer. If you chose option D, you are correct. Collaborating with the interdisciplinary team to develop a plan of care based on the client's preferences and abilities. Collaborating with the interdisciplinary team to develop a plan of care based on the client's preferences and abilities demonstrate advocacy for the client's rights and needs. It ensures that the client's voice is heard and their individual needs and preferences are considered in the care planning process. Question 9. The nurse is caring for a client with a history of heart failure who is receiving digoxin therapy. Which intervention is essential to prevent complications associated with digoxin therapy? Monitoring serum electrolyte levels weekly, assessing for signs of digitalis toxicity, administering the medication with a full glass of water, encouraging increased intake of potassium rich foods. Pause the video and select your answer. If you chose option B, you are correct. Assessing for signs of digitalis toxicity. Assessing for signs of digitalis toxicity is essential to prevent complications associated with digoxin therapy, such as dysrhythmias or gastrointestinal disturbances. Prompt recognition and intervention can prevent serious complications. Question 10. The nurse is caring for a client with a new diagnosis of hypertension. Which intervention is essential to prevent complications associated with hypertension? Administering antihypertensive medication as prescribed, encouraging the client to limit sodium intake, monitoring blood pressure at least once per week, instructing the client to engage in vigorous exercise daily. Pause the video and select your answer. If you chose option A, you are correct. Administering antihypertensive medication as prescribed. Administering antihypertensive medication as prescribed is essential to prevent complications associated with hypertension, such as stroke, heart attack, or kidney disease. Blood pressure control is crucial for reducing the risk of these complications. Click that subscribe button and join us next Wednesday.